Good morning and welcome, board and online viewers, to the April 9th Board of Health meeting. The board meeting is officially called to order at 8 a.m. Well, it's 8:03. This virtual meeting is being streamed live via Facebook and will also be rebroadcast on Facebook and YouTube. The March Board of Health minutes were distributed to the board for the review prior to the meeting. Are there any discussions or amendments to the minutes? If none, may I have a motion to approve the minutes as dispensed? May I have a second? Thank you very much. All in favor, please raise your hands so we can count. Any opposed? Raise your hand, please. Any abstentions? If none, the motion is approved as distributed. Minutes are approved as distributed. Family Health Center has also requested for the board to approve the appointment of a new elected member for their board of directors. The new candidate is Mr. William B. Wagner. The application for the board and biography have been shared with all of us and the board members. Are there any discussions or questions to the approval of his appointment? If there are, I defer the answer to Dr. Bart Irwin. Any questions? May I have a motion to approve the appointment of Mr. Wagner? Thank you, Ms. Margulies. We have a quorum. We have 6 people. May I have a second, Ms. Rascal? All in favor, please raise your hand. Dr. Burns, you might have to speak up because we cannot see you.
I'm sorry. I'm raising my hand.
Thank you. Thank you very much. Appreciate it. Any opposed? Please raise your hand. Any abstentions? If not, motion approved for the approval of Mr. Wagner's appointment to the Family Health Center's Board of Directors. Thank you very much.
Thank you.
Regarding the updates and action items, in May, all board and commission members for the government, including Louisville Metro, will need to complete the ethics training. This virtual training will give an overview of the Ethics Code, Open Records, and Open Meetings Act, and board accountability and oversight. The entire board must watch the training, and this training as well as financial disclosure documents will be sent to your email account, both. If members have already completed the disclosure for this year, please disregard, and the training and disclosure documents will be sent to both your Metro issue email, the Metro boards, as well as your personal account. However, the proof of receipt is only to be completed once. Remember, Ms. Rascal, now we can talk about this. Remember, you should open your Metro board's email account often, at least once a month, to avoid being locked up. If you have been locked up and you cannot get into Metro board's account, please contact Arlana, who will send you to the IT department, who will assist you in the process on how to reopen it or how to have access again. The August meeting for 2025 will be canceled. The board will have a summer break, so please make a note of this. This week is the National Public Health Week. I'm really, really grateful for being able to work along with all of you, for the privilege to our day-to-day work in favor of a healthier Jefferson County community. And the last part is the number of cases reported by the Texas Department of State Health Services has continued to rise. The Secretary of the Department of Health and Human Services said as of Sunday, there have been 642 confirmed cases across 22 states in 2025 of measles, nearly 500 of them in Texas, and most of them are unvaccinated or with unknown vaccine status individuals. The majority of the cases are between 5 and 17-year-old people. Unfortunately, 2 previously healthy unvaccinated children have died, and there's a third death under investigation at this moment. And then I'm using this platform. It is important to remind to our community that measles is a viral infection that can cause severe disease and can be prevented through immunization. As the HHS Secretary shared, the most effective way to prevent measles is vaccination. If you're a parent, please vaccinate your children. If you have any questions, talk to your pediatrician. Now we're going into the perspective sessions, and today our perspective session is Thriving Kids, Kindergarten Readiness, and Public Health. Yes, in the school they said everything is related to public health, and it is. The presenter will be Miss Ashley Brandt. Ms. Brandt has over 15 years of experience in early childhood education. She currently serves as a director of Thriving Kids at Metro United Way here in Louisville, Kentucky. In her role, she oversees Metro United Way's early childhood and youth success work, including serving as the staff lead for Louisville's Early Childhood Collective Impact Coalition. Prior to working at Metro United Way, Ashley received her MBA from University of Louisville after working for over 8 years as an early educator in Washington, D.C. Today, I present to you Ms. Ashley Brandt. Welcome, Ms. Brandt. If you have a presentation that you would like to share, you may do so at this time, and I yield the floor to you. Welcome.
Thank you, Dr. Batista, for that nice introduction. As Dr. Batista said, I'm Ashley Brandt, Director of Thriving Kids at Metro United Way, and I do oversee our early childhood as well as youth work, but we're going to focus today on the early childhood piece, which we sort of identify as prenatal to kindergarten entry. So I am going to share my screen, and hopefully that works. Okay, and let me put it into, okay, does that look right to you all? Yes, okay, great. Okay, so as Dr. Batista mentioned, Metro United Way serves as the backbone for Jefferson County's early childhood collective impact initiative called the Ready for K Alliance. So I'm going to focus on the work of Ready for K and how just generally around kindergarten readiness, as well as the different aspects that we're involved in, and I definitely highlight some of the health aspects as well. So, okay, so Ready for K is a coalition of individuals and organizations. We have over 100 partners that are all working together to support children and families in Jefferson County. So this coalition is made up of a very diverse group. Really, anybody that's operating in that early childhood space is welcome to join and be a part of our collective. So we have everybody from childcare providers, the public library, pediatricians and funders and everybody in between, as well as the health department and local government as well. So it's a pretty diverse group, but everybody that's part of the alliance is operating in the early childhood space in some way. And so really the reason that an alliance and coalition like this is needed is unlike the K through 12 space where we have a single entity where the majority of children in Jefferson County are showing up, which would be JCPS, our public school system. In that early childhood space before kindergarten, there isn't a single entity where most families are showing up. So we really need to be pulling together all the places and programs that families may be engaging with and really create this unified system and interconnected web of services for families. So the vision for the Ready for K Alliance is that all children enter kindergarten ready to thrive, and we're focused in these 4 areas. So health is one of our outcomes areas. The other 3, access and quality, is focused on access to high quality and affordable childcare. Family and caregiver engagement is focus on supporting the adults and systems that support a child. We know that children under 5 and really probably children up to 24, maybe, they are very reliant on the adults and systems that surround them to determine their outcomes. So we want to make sure that those individuals and adults have the supports they need. And that last piece is what I mentioned previously around the systems alignment of really bringing together all the different entities that are operating in this space to make sure that we are all aligned, have a unified vision, and are working together to achieve this goal. So this is a lot, and I think they'll share the slides with you after, so I'm not going to read through all this, but what is kindergarten readiness? So in Kentucky, we are actually fortunate to have a measure for kindergarten readiness. Our public schools use a standardized screener called the Brandt, which all children that enter kindergarten and JCPS are screened with. And these are sort of the areas that are focused on. So at a high level, it's really about, communication, cognitive skills, physical skills, fine and gross motor, social, emotional, especially some of those self-help, as well as regulation. How are children able to operate as part of a group, as a collective in a classroom, and really be able to learn together. So it spans all of those different areas, and all of those there's not one that's more important than any other. These are all things that we need to be supporting children with before that first day of kindergarten so that they can thrive when they do start. So why are we focused on kindergarten readiness? And why is this a big metric that really, as a community, we need to be aware of and working to improve? So really, there's a lot of data around the longitudinal impacts of kindergarten readiness. So those children that show up ready on that first day of kindergarten are more likely to have success later in life. And I will, on the next slide, show you some Kentucky specific data around this. But we know that the impacts of readiness have long lasting effects, reducing the need for special education, increased college attendance. So really very longitudinal, looking ahead, 15 years from that first day of kindergarten, that we still see that is an important measure, that if a child shows up ready, they will have better success later on. But that said, in Jefferson County in 2023, only 43.7% of children were ready based on the Brigance. And this is a graph showing kindergarten readiness over the last 10 years in Kentucky. So you can see a major impact of COVID that we are still greatly recovering from. But even pre-COVID, the highest rate we had was 52% ready. So even before those really impactful years where children weren't in the classroom, we were still not at a place where we could be proud to say, only 50% of our kids are showing up ready. There's still a lot of work to be done there. And this is the Kentucky specific data around the correlation between kindergarten readiness and third grade reading. So the top section where it says kindergarten ready with enrichments, when I went to school, that was like gifted and talented is sort of what we called it. So those kids, they're the strongest, they're doing the best. And you can see in the novice column, there's none listed there, and that remains through third grade reading. Then you have the kindergarten ready group. That's sort of, the middle of the road. That's where we want everybody to be, at least at that point. You can see there, again, pretty consistent scores based on their kindergarten readiness score and third grade reading. And then ready with interventions is what we would consider not ready. So you can see those have the highest percentage in the novice section, also the highest 4% held back before third grade. So we can see, the implications longitudinal on these third grade math as well as reading scores for those different groups and how they're scoring. So what are we doing about this? So Ready for K, as I mentioned, our goal is that all children enter kindergarten ready to thrive. I will just say that that language is intentionally broad because every child is different and unique and has their own needs. So what thriving looks like for one child may be completely different for a second one. So it's really just optimizing and making sure that every child has what they need, no matter what that may be. So again, we're focused on these 4 areas, and specifically the health piece, born healthy and achieve appropriate developmental milestones. Those are the big pieces for us. That born healthy, we know that there's some great health disparities in maternal health in our community. So focusing on that to ensure that prenatally, as well as in that first year of life, that there are the supports for the birthing parent as well as the child to ensure that strong start even from birth. Okay, so a couple pieces that I just wanted to highlight around Ready for K's work. And once I stop sharing, I'm going to share a bunch of links in the chat so that you all can have access to a lot of these things. But just wanted to flag, and this is in no way a list fully comprehensive, but just some pieces that I really wanted to share with you that I think are aligned and potentially ways that we can, work together. Just want to make sure that you're even just aware of them. So in 2003, Metro United Way received a grant from the CDC to support lead poisoning prevention work in Jefferson County. In the first year of that, the Alliance and partners that are engaged in lead poisoning prevention work came together to develop Louisville's Lead Safe strategic plan. So we are in year 1 of implementing that strategic plan right now, and really sort of bringing together a collective mentality around this work. There is a lot of work happening related to lead in our community. That's great. But previous to this strategic plan, it had been very much siloed and working on its own. So we're really trying to work together to identify how partners can really optimize their work by working as a coalition, and again, creating that interconnected web of services and supports for families. We know that lead is still, unfortunately, a really big issue in our community. We have a lot of pre-1978 housing, which is when lead was banned. So, we know that, unfortunately, also there's a lot of disparities across our community in who is living in that pre-1978 housing. So a lot of work happening in that space at the systems and policy level, as well as at the programmatic level to ensure families have the supports they need to be able to support their child, hopefully prevent poisoning to begin with, but if not, have supports after if their child does test high with an elevated blood level. And I will just give a shout out to LMPHW. They are a primary partner in a lot of this work. So they've been amazing to work with and have a partnership with on this. And I will say Ready for K, this is a great time to say this, Ready for K is not doing its own direct service work. So we are really reliant on the partners to be doing that work. And we're sort of the behind the scenes, creating that alignment, identifying partnerships, looking for funding to support that work, and all of those pieces. So our partnerships with the direct service providers is key in making sure all of these pieces actually happen. The next piece on here is the ages and stages. Now I say it says states, sorry, missed that typo, stages developmental screening. So that Metro United Way serves as the hub for the ages and stages. And it is a program that is open to any family in Metro United Way's 7-county region, actually, but definitely in Jefferson County. So we have, it's completely free, and it is a developmental screener that is for children starting from 2 months all the way up to 5.5 years old. So when a family enrolls in the program, again, it's free. They receive a screener every 3 to 6 months, depending on the age of their child. And once they complete that screener, then we have staff that follows up with them, says it looks like your child is on track in all these areas. They're showing all these great strengths. Here's one area maybe we could help bolster a little bit, and here's resources to do that. Our staff also makes direct referrals to other agencies. So what we call it the hub, our Ages and Stages hub. We are HIPAA compliant, so we make referrals directly to JCPS Early Childhood, First Steps as well, which is now Keys, as well as, you know, many other services. Those First Steps and JCPS and Head Start are our three most common referrals. And those are based on the scores of the developmental screener, but then also just conversations that our staff has with families and caregivers. And then we also ask, is there any other supports you need? So we're using the screener to identify developmental supports that may be needed, but we're ensuring that those families also have all the wraparound and basic needs supports that they need, because we know that, you know, a family's not thinking about reading a book before bedtime if they're worried about their housing. So making sure that they have all the resources they need. And that program has expanded recently. We do have direct partnership with pediatricians across Jefferson County, where pediatric offices are making direct referrals to our hub of families to enroll them in the hub. So if that's something you're interested in, or know a pediatric office or a pediatrician themselves that may be interested, we're always expanding and looking for more partners, and happy to follow up on that. And then internally, we've also made some improvements and grown our work to reach more ELL families, English language learners. So we now have an interpretation line. We have the screener available in English, Spanish, Haitian Creole, and Kinyarwanda. So, and we're working to identify more languages as well. So that's a great program, again, completely free. And every time the family completes a screener, not only do they receive that support from our staff, but they receive a free book in the mail, as well as developmentally appropriate activities, so to do at home. And then supports for high quality and affordable childcare. One of the reasons that in the early childhood space, we are so focused on childcare, and I'm sure you've heard it in the news, especially during COVID, you know, how that ecosystem is really suffering, is because children that attend a formal setting before the first day of kindergarten are exponentially more likely to be ready for kindergarten. So that could be JCPS Early Childhood, that could be Head Start, that could be a private childcare, but basically a child who's outside of the home in a formal setting, their readiness rates are up into the 70 percentile. So that's, as you saw, much higher than the average readiness rate. So we want to make sure that that ecosystem of childcare has what it needs to be able to survive and thrive, so that it can then support families and children as well. And we know that not only is childcare beneficial to the child, but it also allows parents and caregivers to go back to work, to go back to school, and it creates a better workforce for our community as well. So that's such an important ecosystem for our community. And we also know that children in childcare, well, they're probably exposed to a lot more illness, which is great. They're building their immune system, but they're also getting their vaccines at a higher rate because they're required to provide those things as far as being in a formal setting and state health and safety requirements. So also key pieces around that. Again, connection and resource sharing, a big part of the work we do, just making sure that all these partners who are working in the early childhood space are aware of all the other work that's happening. We know when a family shows up for one resource, they probably need at least one more. So how can we make sure they're connected to everything else that's available to them to help them survive and thrive? And then the last piece is policy and advocacy. So this is a big piece of our work, and I'm gonna go to the next slide. So Ready for K has our own policy agenda. If you're familiar with Metro United Way, Metro United Way has a policy agenda as well. Ready for K has its own that's hyper-focused on just that birth, prenatal to kindergarten entry space. So this agenda is updated annually. We just wrapped up the 2025 legislative session, but are going into some local policy work as well. So we will update this probably in October, November, in preparation for the next state legislative session. This is the priorities for healthy development. And how this is laid out is the top bullet points are really the ones that we think have momentum or an appetite to move or have progress on in this year. And then the guiding principles allow us to say if anything comes up that is an opportunity for us that's related to these pieces that guide our work, then we can take that up as well as a coalition. I will flag the last bullet point under the 2025 priorities around the implementation of the lead rental registry. If you are not aware, there was legislation at the state level that would have preempted any local rental registry, not just lead. And so in order to avoid that state legislation from passing and eliminating any opportunity for rental registries, our local Metro Council passed 2 new ordinances which greatly modified the lead rental registry. And I think Connie was on this call. She can probably talk a lot about that. But just a flag that in that lead space, we are in the process of identifying with the new local ordinances how that's going to transition some of our work there. And then this is, I won't go into this as much, but this is our policy agenda is laid out just as our different outcome areas. So this is family and caregiver engagement. And then the third one, access and quality, you can see the most comprehensive and long, just because legislation is one of the most impactful pieces for childcare. So we do a lot of work in the policy space related to childcare, mostly to try to unlock public dollars to support that ecosystem. Okay, so that's everything that I prepared. I'm happy to, like I said, I'm going to share a couple links in the chat once I stop sharing, but I'm happy to answer any questions or if there's anything anyone wanted to discuss further. I'll stop sharing so I can see everybody.
Thank you very much, Ms. Brandt. Appreciate it. And we have a question from Ms. Margolis.
Thank you, Madam Chair, and very, very good and concise presentation. Can you speak a little bit about the outreach, describe more the strategy that you use for outreach? Because clearly in the Jefferson County school system, that is really well defined. And my concern, if I have any concerns, is what happens to people who fall through all the other nets that are out there? How do we know that we're reaching the hard to reach?
Yeah, so that's right, the hardest group to reach. So so just a couple pieces. So Ready for K, we are a coalition of community partners, community organizations, not a coalition of parents or families. Obviously there are parents part of it, but they're there representing their organization. So for Ready for K, we don't have direct communication or connection to parents and families. What we do is we utilize our coalition to do that. So that's a big part of the resource sharing, is that making sure, you know, when the health center is having a fair coming up, that we share that information out with all of our partners so that then they are sharing it out with the families they serve. So, and I will put this out to all of you as well. If there is anything that you ever want to get out to that coalition, we have a list of around 700 people. So that's always a offer to community partners. If there's anything to get out to organizations, again, not directly to families, that please, don't hesitate to send it to me. But yes, to your question about reaching those individuals who are not in a formal setting or are not engaged with community partners, that is the hardest group. How do we find them? So one way that we do that is really partnering with grassroots organizations who are embedded in neighborhoods. So Metro United Way has a partnership with Play Cousins Collective as part of our Ages and Stages work. And we support Play Cousins to have boots on the ground staff that literally sit at bus stops, go to the Kroger in Lyles Mall, show up at the library and say, hey, have you heard of this program? It's completely free. We'd love for you to sign up. And so that's sort of one way of finding those people who aren't engaged. Our Ages and Stages program has always been focused on prioritizing families who are not in a traditional setting, because we know that a child that completes 4 or more questionnaires, no matter if they've been in a previous setting or not, they're more likely to be ready for kindergarten. So really utilizing those organizations that are embedded in the communities that we want to reach to be the trusted partner to do that type of outreach, and supporting them so that they can do that, since they are mostly very grassroots organizations.
Thank you.
Yeah.
Thank you very much. Anybody else? Deputy Mayor George.
Thank you, Chair, and thank you, Ashley, for the presentation. Certainly think all the data helps inform why this needs focus. My first question is, what percentage of ESL families do you think are impacting kindergarten readiness? How does that fit? I know you mentioned COVID, but in addition to COVID, how would you say ESL and kind of to Heidi's point, what are some more proactive touch points that you recommend where we could connect with families?
Yeah, so there's a couple of pieces to that. So I don't have that direct number off the top of my head. I can get it from JCPS. They do track those kindergarten readiness scores by different demographics. I will say, just having seen data from previous years, that English language learners are one of the lowest scoring groups on that kindergarten screener. And there's at surface level, that doesn't sound great, but if we peel back a little bit, when a child is administered that screener, if they need it, they should be provided with a translator. That's not always happening. So it's not necessarily the best indication of that child's capabilities if they're being administered a screener in English when their first language is not English. So we have to take that with a little bit of a grain of salt as well. And say that not necessarily all the supports are in place to get the best read on the readiness there. But English language learners are the #1 growing population in JCPS. We know that. So that is a population that we need to be serving, doing more and serving better. But again, the piece about partnering with organizations that are really in the weeds, grassroots, Metro United Way has really strong partnerships with La Casita, with Backside Learning, with Americana, KRM, Catholic Charities. These are the partners that we know are trusted in those communities. Nobody wants to see Ashley Brandt from Metro United Way showing up to offer them supports. They want to see someone who looks like them, who sounds like them, is speaking their language. So making sure that we are supporting those organizations that are embedded in those communities, have those trusted relationships, now more than ever when there is so much fear, in different communities. So that would be my recommendation, is to really bolster these nonprofits that are doing this on the ground work.
Okay, thank you.
Thank
And
you
then
very
my
much.
last question is, remind us, and you might have touched on this, but the fit with Thrive by Five and how Ready for K fits with the work of Thrive by Five.
Yeah, so we're really excited to have Thrive by Five as one of Ready for K's newest partners. And Thrive by Five is, for those of you that don't know, Thrive by Five was the new 501c3 that came out of the mayor's initiative to support early childhood and universal pre-K. They just recently announced their new executive director and are really just getting off the ground. But they are a Ready for K partner. They actually were just nominated to join Ready for K's leadership team. One of the things I should have said and always like to make clear is that the design of Ready for K is that we have a leadership team that are the decision makers. I am not the decision maker for Ready for K. So Thrive by Five was recently nominated and added to that leadership group, and they will be a key partner in our work focused on access to high quality and affordable childcare. I know their work is going to start by focusing on the workforce of early childhood educators, which is so needed. So we look forward to working in partnership with them, just like all of our other Ready for K partners.
Thank you so much. Thank you, Mayor, Deputy Mayor. Anybody else? Any more questions? Ms. Eleanor Manson?
Yes, thank you, Ashley. That was an incredible presentation. I'm from the Kentucky Nurses Association, and I'm curious with your great coalition and how you're building and working together, what are you doing to help with vaccinations for the children?
Yeah, so vaccinations isn't an area where we've specifically identified as one of our priorities, but I will say anything that influences the early childhood space, we are open to. And I think the best example of this is lead. Before 2020, Ready for K wasn't doing anything in the lead space. We had a partner approach us and say, hey, I think you really need to hear this presentation from Dr. Brian Gwynn at U of L. He has great data on lead. And he came and presented, and our coalition was like, man, we really need to be doing something in this space. So if there's an issue that I didn't touch on today that you feel is really crucial in the early childhood space, I would love to learn more. I would love to have the opportunity to invite you to any of our meetings to share about what we could or should be doing in that space. Ready for K, we have quarterly meetings with all partners. We usually have about 50 to 70 partners that come to those, as well as we have quarterly lunch and learns. So that's typically the lunch and learns are an opportunity for maybe there's a topic that we haven't delved into, but we really want partners to be aware of. We'll bring in an expert to present on that and build that awareness, and then have discussion around, as a coalition, what should we be doing. So would love to follow up on next steps on that, and if there are pieces that we can be doing also as in that space around vaccinations.
Great.
Thank you very much, Ms. Brandt. Appreciate your presentation and all this motivation to be involved with preschool education and the importance of that. We will continue with our agenda. Now I will yield the floor to Deputy Mayor Nicole George.
Thank you, Chair, and thanks for putting together an interesting topic for conversation this morning. I'm going to defer most of my time to the health department because I know they have many important things they're working on, and I see Connie is here. Do want to mention just on the front end, Mayor's office has recently been made aware of some very concerning instances of human trafficking involving what we'll call massage establishments. And so we're working very closely with the health department to learn more and to develop planning and response. So that's certainly something that has been a focus from the mayor's office. The second thing I would just say is obviously we're underway in terms of storm debris management, cleanup, obviously a lot of concerns with events happening over the last week. A lot of cleanup opportunities will be coming up. And so as we think about ways to kind of connect with the community and give back, I would encourage folks to be on the lookout for those. Thank you.
Thank you very much, Deputy Mayor George, for that update. Now I yield the floor to our Chief Health Strategist, Connie Mendel.
Good morning. Thank you. Everyone should have a copy in their materials of the Board of Health or our report to the board. Please read through that. I'm not going to touch all of those things here to make the best use of your time. But a lot of what's in the report does align really well with Ashley's presentation and Ready for K, because as she mentioned and others, this is public health. Absolutely. So, and even the first item on the report, we need some safe sleep partners. Please read the information there. Our maternal child health program and teams work. This one is specifically around sudden unexpected infant death. So preventing that by providing portable cribs and safe sleep resources. So we have partnered with numerous agencies and entities in Louisville and have been able to distribute 400 safe sleep kits to Louisville families, and that's just since July. And we have more. So please, if there is someone that you know or your organizations may be interested in partnering with us in providing matching funds, so we can maximize our resources. And if you know of someone who lives in Jefferson County and has a child under the age of 1, and they need a safe place for their baby to sleep, please reach out to us. The contact information is there. I can't say how important this is in keeping our infants and small children safe. There is additional information about our Healthy Start campaign. So again, this aligns well with Ashley, and having safe, healthy infants, safe birth weights, and removing other complications. So we work with postpartum individuals, prenatal and infants up through 18 months specifically with Healthy Start. So this includes home visits and just ensuring that the new parents are safe, adjusting. There's some mental health screening, and making sure that they have connections to healthcare providers, a primary care provider, and many, many other services. So again, someone expecting or a child through 18 months, please refer them to our Healthy Start program. There's some information there, and I'll let you read that as far as opioid settlement disbursements. We are still fighting the opioid epidemic in Metro Louisville area. So a lot of great work going on. This latest round, a lot of that focus is going to be on prevention. So, the health department, and working with the community and Metro government as a whole and Metro Council, we're looking at, what we can do and how to use these settlement funds the best way possible. So the first round, we were looking at saving lives, and a lot of that dealt directly with providing Narcan or naloxone to the community. We have to save people to help them reach their best potential. And so this round, a lot of that focus is prevention, primary prevention, working with Jefferson County schools and after school programs, but there's also work there with the Jefferson County Circuit Courts when we look at mental health division and supports, and also diversion. So there's plenty more information on our webpage if you're interested. I do want to take the opportunity to celebrate some of our team members that have gotten some statewide awards. So we're very excited for them, particularly Angela Graham, our Executive Administrator of Research and Academic Health, received the Changemaker Award at the Kentucky Public Health Association meeting last month, along with Haritha Pelham, who got Outstanding Epidemiologist of the Year. Our quick response team, there's been quite a bit in the newspapers about the work they do with people that are very recently experienced an overdose, and visiting their homes or wherever they're at to get them supports. So they received the association's group award. At the Kentucky Environmental Health Association, one of our environmentalists received the Outstanding Sanitarian of the Year. And then also our TB clinic supervisor received the Super T Award. So in all of her and her team's fight against tuberculosis. So, with Public Health Week, just had to take a few minutes of your time to share that. I know Ashley had mentioned the changes to the lead ordinance. So there's more information in there. And I will say anyone, particularly in rental property, or anyone that's concerned about potentially lead hazards in a home that's older than 1978, we encourage you to reach out and request an inspection. And then, of course, children children where lead has been identified in their blood, they're referred to us, but you can always reach out on those also. But again, lead is a concern for our community, and it has lifelong implications if not addressed early. So that is one of our big priorities. And lastly, I'll touch on mental health. There is a free workshop on the 16th of this month. Don't be afraid of the conversation. And this is, you know, we know that mental health is a problem right now in our community. And a lot of concerns just throughout, whether it's, you know, related to post-COVID, whether it's related to substance use issues, but mental health is certainly a concern. So please share that information. It is not only our we'll address topics related to mental health, substance use, and other areas. So, you know, we want to reduce the stigma around this. All of us at times of our life need help, and we need to work on our own mental health. So this is not just for our clients, but for our practitioners. So please share this information, and it's in the report for you to register. And that will do it for me today, unless there's anyone that has questions.
Any questions for our Chief Health Strategist? Thank you very much, Connie Mendel, for your update. Now we go to Family Health Centers. Now I yield the floor to Dr. Bart Irwin.
Thank you very much, and I appreciate everyone approving Bill Wagner as a board member. I think he'll be fantastic. I wanted to mention quickly, why does the Board of Health approve Family Health Center board members? It's because we have a history. We're linked together, and I wanted to explain what that is briefly. The Board of Health used to operate the little memorial hospital, which was on the property that Family Health Centers is now located in Portland. In the mid-'70s, it was decided to close that hospital, and the Board of Health at that point created the Louisville Memorial Primary Care Clinic and operated that clinic. In the mid-'80s, it was decided that the Board of Health would withdraw from the direct practice of primary care, so Family Health Centers was created at that time. However, Family Health Centers remained a component unit of the Board of Health, which means although we're separate organizations, Family Health Centers carries out the mission and the work of the Board of Health. So that's our unique relationship. We're a federally qualified health center, so we have to be independent and have an independent board. That's why we choose the board member, and as a formality, the Board of Health approves that member. One other important thing, and there are several others, is that the Board of Health maintains a self-insurance trust fund for Family Health Centers. The amount of that fund is about $2 million. It used to be used for general liability and malpractice. We have our own malpractice insurance through the federal government now, so it's just for general liability. And occasionally we come to you and ask for the board to approve covering trips and falls and that kind of thing. So that's our unique relationship. Any questions about all that? Okay. Every once in a while, I like to remind, especially for the new members, that we have this unique relationship. Now, I think Doris has a report on Medicaid.
We pass to Mr. Furman. Thank you so much, Dr. Irwin, for the clarification. Please go ahead, Ms. Furman. Go ahead, Ms. Furman.
We're not able to hear you.
Yeah. It doesn't look like she's muted, so that we may be having some technical problems. Madam Chairperson, you might want to move on. And
Yes, Ms. Furman, could you please just type all your information if possible, or share it with Ms. Arlana, and we'll distribute the information along with all the links that Ms. Brandt has shared with us. Thank you, appreciate it. And now we are, I'm not sure if we have a representative from JCPS. I don't think we do. So we go to Greater Louisville Medical Society with Dr. Anita Bhatia. Dr. Bhatia, I yield the floor to you.
Good morning again. I think I've gone onto my phone device to help with the camera, so I hope you can all see me. But exciting things to report. We did have the doctor's ball that I mentioned to you on the 8th of March, and that basically is a platform to honor and celebrate the achievements of the doctors in the community, some physicians with this unwavering commitment to elevate the standards of health within the community. So we had the recipients of the Doctors Ball were from the Baptist Health Louisville Physician Group. We had the Physician of the Year, Michael Comer. From Norton's, we had Francesca Kingery, who is a pediatric hospitalist. And then from the Louisville Health Physicians of the Year, we had Jennifer Cork. And the community-based physician of the year was Dr. Frank Burns. And then, of course, the Paragon Award went to Mona Lisa, who we know was an ex-president of the Greater Louisville Medical Society and then the Kentucky Medical Association, and now is our connect with the American Medical Association as well. Not to mention that one of the recipients and nominees was also Dr. Bruce Scott, who is currently the president of the American Medical Association. So Kentucky has a big platform at the American Medical Association because we've had at least 2 or 3 presidents in the last few years from Kentucky who have basically gone through GLMS, KMA, and so on and so forth. And then I wanted to let everybody know that we have our next for the year 2025 to 2026, we have our Greater Presidents Celebration on the 10th of May, where we will be welcoming the incoming president, Dr. Thomas Higgins, and the outgoing president will be Dr. Louis Hargett. My replacement will be Dr. Jeffrey Goldberg, who would be then the vice president. I would move on to being president-elect. But I have so enjoyed. I will be here in the May for the May meeting as well, but I've so much enjoyed being part of this Louisville Medical, this Metro Public Health and Wellness committee, the board itself, and all. And I've loved the participation and the knowledge that I have gained from this. So is there any way that sometimes if I want to log in and listen to your Wednesday meetings, apart from I'm not a Facebook person, that there is a possibility for us, the GLMS officers who've been on this before, to attend anything? I'd like to certainly explore that option, but more to follow in the May meeting. Thank you very much again.
Thank you very much, Dr. Bhatia. We will explore that and I'll ask and we'll let you know the results of the inquiry. And congratulations to our board member, Dr. Burns, for the award received. We now yield the floor to Ms. Delano Manson, the Kentucky Nurses Association representative. Ms. Delano.
Good morning. I just would like to invite all of you, and you can share this information. We are providing a measles update by Dr. Ruth Carrico on April the 23rd from 6 to 7. You can go to our website and register. We have only 150 people registered so far. I'm shooting for 400. So please come, listen, learn. Thank you.
Thank you, Ms. Manson. If you could please share the registration link to Ms. Arlana so we can distribute it and share with everybody else.
Will do.
I appreciate it. We don't have a representative from the Greater Louisville Inc., but I would like, and Dr. Carrico for the Immunization Committee is not able to join us today. I would like to thank Dr. Cardarelli that has moved into a different role and position within U of L. And I want also to welcome Dr. Kathy Baumgartner, the interim dean for School of Public Health and Informational Sciences. Thank you very much for being with us today, Dr. Baumgartner. And is there any old business that we need to take care of? I want to appreciate Dr. Irwin for sharing that piece of history and information that is valuable and helps to make sense of why we're doing the things we're doing. And is there any new business that we need to take care of?
Not
And
new
if
business.
not,
I wanted to congratulate Dr. Wagner to be part of your board. I think he would make a great addition, and that's awesome. Thank you. That's
Thanks.
awesome.
thank you, Dr. Bhatia. Anybody else? And Ms. Furman will share all her information with Arlana, and she has already typed some things for here on the chat for us. And we have no any new updates. I want to thank everybody for taking your time to participate in this month's meeting. The next meeting will be held on Wednesday, May 7th at 8 a.m. This will be a virtual meeting. If no further business, the meeting is officially adjourned for today. Thank you very much, everybody. Have a beautiful day. Thanks again. See you next month.